Good evening to each of you choosing to make health and wellness a priority for our community. I am your host, Gustav Ajay, welcoming you to Medical Mondays with Dr. O. Medical Mondays is here to provide information and empower you to live a healthy life. From nutrition, exercising, resting, taking care of your body and mind, to having access to renowned healthcare practitioners, professionals, experts. Medical Mondays with Dr. O introduces health information, medical facts, and possible solutions as we examine health challenges to enable each of us live our best lives. Be reminded that we are not establishing doctor-patient relationship with you, rather giving you relevant medical information to accord you strong health, strong future. Dr. Toyin Opesema, Dr. O, sends her love and appreciation. She will not be here with us on the show tonight, and she's already missing you and will be back soon. Our topic for discussion is fibroids and fertility. The august personality to break it down is a fellow of the American Congress of Obstetricians and Gynecologists. Our speaker is the founder of the Montgomery Fertility Center in Rockville, Maryland. My guest, board certified in reproductive endocrinology and infertility, as well as obstetrics and gynecology, is also an associate clinical professor of obstetrics and gynecology at George Washington University School of Medicine and an attending physician at Holy Cross Hospital in the Department of Obstetrics and Gynecology in Silver Spring, Maryland. Having lectured at a number of medical conferences and participated in research affecting women's health, this learned fellow is at the forefront of providing state-of-the-art care based on emergent and ongoing new technologies and research. This is based on a philosophy to provide exceptional care in the most compassionate manner in order to achieve the best possible outcomes for a patient. This has been recognized with numerous awards, including Top Doctor in Washington, Baltimore in 2012, Castle Connolly Top Doctor from 2012 to 2020, missing out only on 2015. She received the Castle Connolly Exceptional Women in Medicine Award in 2017, 2018, 2019, and 2020. She was named one of Bethesda Magazine Top Doctors in 2019, an impressive honor awarded after extensive peer nomination and physician-led research process. She has numerous publications in peer-reviewed journals and participates with the Oncofertility Consortium as both a clinician and co-author. Ladies and gentlemen, our guest speaker is Dr. Oluyemisi Famuyiwa. If you have questions as you listen to Medical Mondays, kindly drop them in the chat box or raise your hand to be called. Dr. Yemi, welcome to Medical Mondays with Dr. O.
Thank you so much for that very generous and kind introduction. I am very pleased to be here. Thank you, everybody, for your time. I know you could be eating dinner somewhere, so I really thank you so much for being with us tonight. What we'd like to do is to talk about fibroids and also fibroids and fertility. So I'm going to start. I'm going to show you my slides. Can you see my?
Yes, we can see.
Thank you so much. All right. So thank you so much for being here. So what we're going to do is try to talk a little bit about fibroids and fertility. And what I'd really like to do is engage you, my fellow audience. I'd like you to sort of talk about, ask questions as we go along, and please feel free to engage as you desire, okay? So we're going to talk about fibroids and fertility today. what is a fibroid? A fibroid is a smooth muscle tumor that usually derives from one cell that tends to multiply and expand. As it expands, it compresses the cells around it, forming what we call a pseudo capsule. And this capsule can be used to shell out the fibroid per se. What kind of fibroids are there? There could be a fibroid right inside the muscle, inside the cavity of the uterus. That's called an submucosal fibroid. If it's located in the muscle of the uterus, it's called intramural. If it's located slightly off to the side of the uterus, it's called the subserosal. And sometimes it could just kind of be dangling off to the side, and that's called the pedunculated. Most fibroids are not cancerous, and it is felt that when you see a tumor, a cancerous tumor in a fibroid, it usually doesn't come from the pre-existing fibroid. So it may be somewhere de novo, and it's so rare, it's about one in 1,000 cases. How often do you see fibroids? It is very prevalent, especially in African Americans, people of our genre, Africans. You see it up to 20 to 80% of women develop fibroids by age 50. So it's not common in younger women. It's more common in women, so between 30, 40 to age 50. You don't really see it in teenagers and in their 20s. What are the symptoms of fibroids? The most common one is heavy bleeding. That is because if it's located right in the, I don't know if you can see my arrow, if it's located in the cavity or it protrudes into the cavity, it distorts the lining and causes excessive bleeding. Sometimes the fibroids can grow rapidly and cause pain. If they grow rapidly in pregnancy, they could cause severe pain during pregnancy. Sometimes they get so big that it could be almost like a pregnant uterus, and it presses the bladder from in front, and it can also press the rectum. So you get a lot of frequent urination, rectal pressure. Other symptoms could include pregnancy complications. So it may affect the pregnancy in terms of where the baby can fit in the uterus. It can distort that. It can also cause infertility by blocking the fallopian tubes. It can cause a pregnancy to dislodge early and cause miscarriage. So not only pregnancy complications, complications with fertility. How do you, did I miss a slide? Let me see, yeah. Okay. How is it diagnosed? Typically diagnosed by ultrasound, pelvic ultrasound, abdominal ultrasound. An MRI study can pick it up, and something we call a sonohysterogram, which is really an ultrasound where you inject saline into the uterus as the ultrasound is being done. It can complicate pregnancy. I guess I missed that slide in that location. It's noted in up to 12% of pregnancies, can cause early delivery of the fetus, and it can also distort the anatomy of the uterus such that the baby comes out in a breech position. And that could lead to a cesarean section. It can distort and remove the placenta from its attachment. That's called a placental abruption. It can interfere with the labor process or prolong labor. And as I said earlier, it causes pain when it rapidly grows. What causes fibroids? We don't truly know. It runs in family. We know there's a genetic component to it. There's hormonal issues with it. So if you have elevated estrogen, can cause the fibroids to grow. How is it related to fertility? If you have a big fibroid, it could distort the anatomy, the shape of the cervix, and affect the sperm passing through. It can affect the shape of the uterus and interfere with the movement of the sperm and movement of the embryo into the cavity. It can cause the fallopian tubes to be blocked. It can impact the lining of the uterine cavity, causing lack of implantation. It does not let the embryo stick very well. We call that failure of implantation. How is it treated? There's medications such as GnRH antagonist. It's an oral agent, but it's very temporary. Most of these are all temporary, meaning that when you stop, the effect of it wears off. One of the medications that's taken off the market is ulipristal because it can cause liver damage. Other treatment, if you desire to maintain your fertility, it's recommended that you consider a myomectomy, a definitive treatment. If you do a hysterectomy, that definitely takes care of everything. Some people prefer to just burn the lining of the uterus so the avenue where heavy bleeding is induced is curtailed. The only problem with that is you continue to have ongoing spotting and bleeding issues. Newer techniques now is to stick a needle right into the fibroid and superheat the needle or superfreeze the needle. And typically this is done by laparoscopy, where you can stick a needle right into it and cause thermal or cold damage. Another technique is to use an MRI, patients in an MRI, and they use ultrasound waves coming from several angles. So they meet at a certain point within the patient where the MRI is located, and it just sort of desiccates the fibroid and the patient can go home at the same time. Embolization of the uterine artery can be done. There's always an argument about whether or not that is good, because if you embolize the uterine blood vessels going to the uterus, you could cause artificial embolization of the artery to the ovary or to the lining of the uterus. So usually not advocated if you still want to maintain pregnancy. I already talked about the high frequency ultrasound. That's what I mean by that. If you have high frequency or ultrasound, it desiccates a fibroid, and it's usually done with MRI guidance. How do you prevent it? Things that will keep you healthy will also help prevent it. It is advised to avoid high fat processed meats, beef, that may be high in hormones, estrogen. And that's because a lot of the dairy farmers may give hormones to the cattle, and guess what? You will ingest the same. High fat dairy products, because again, the cattle are given a lot of hormones, steroids that you can then consume. Salty food may affect the ability of the liver to properly remove toxins. So you want to probably have a lower salt diet. Other things you can do is avoid refined carbohydrates, white rice, white bread, pasta, cakes, cookies. Those things can alter estrogen levels and cause fibroids to increase. Now, another thing is I love tea. I love herbal teas, but apparently raspberry tea is probably the one I would avoid because it may have an estrogen-like effect on the body. Anything that raises estrogen will cause fibroids, so avoid that. Fruits, vegetables, lots of fruits and vegetables will be very good for you. Normal blood pressure, reduce stress, and also consume vitamin D. So I'm going to entertain questions. I'm going to close down the presentation, and I'd like us to have a lively discussion of questions.
You're muted.
Oh, I'm sorry.
Thank you so much, Dr. Yemi.
I'm muted? Oh.
No, I am. I was
I'm
muted, but I'm
okay.
okay now.
Okay.
Remember, let your questions come, drop them in the chat box, or you can raise your hand and then we will call you. Please share Medical Mondays link. On YouTube, it is Medical Mondays with Dr. O. And remember to hit the like button. It doesn't have to click the like button, but it helps grow the channel. And don't forget to subscribe to our Medical Monday channel. You spoke about embolization. What are the benefits?
Uterine artery embolization, you have to select the type of fibroid that you're going to use for this. It's not advised if somebody is still planning on getting pregnant. So let's remove that category of people from there. For people who have medium-sized fibroids, this is a good option. They can get, it's an outpatient procedure. You get the embolization done, you go home the same day, and it works. It cuts down bleeding, but you have to choose the right size. If you choose a fibroid that's located on the inside of a cavity, you could cause that cavity to abort, sort of they extrude it out through the cervix, and that can actually cause a situation where the patient has severe pain and bleeding. Some fibroids, if they're not quite in the cavity, but they're close, when you have uterine artery embolization, you create a connection between that fibroid and the cavity, which is like a fistula, right? If you embolize a large uterus, that uterus is still there, it didn't go anywhere. You cut off the blood supply. The patient has extensive pain. So it results in them needing a hysterectomy after the procedure that supposedly was supposed to take care of it. And the problem is when you've already embolized them, the hysterectomy may not necessarily be an easy hysterectomy. It has more complications. So the proper fibroid, I can't emphasize enough, you have to be selected for the proper fibroid. If in doubt, consult your gynecologist, not the radiologist. Consult your gynecologist and ask, is this the appropriate fibroid for this particular procedure?
Thank you so much. There's another question coming up from the chat from Janet Mensah, and she's asking, is there any recommended tea that melts fibroid? Is it good for removing fibroids in the body than the normal operations by doctors?
So I don't know of any, really. Most of that is hearsay, and there's no such randomized clinical trial. So we as doctors are very hesitant to recommend something that doesn't have a scientific background to it. So, I personally like herbal tea. So I like, raspberry tea. I like apple, lemon zinger. The only thing that I found in the literature that was recommended is the raspberry one. The leaf can increase estradiol levels, and anything that increases your estradiol levels can make things worse.
We have another one from Daisy Jones. Will fibroids return after a hysterectomy due to overgrowth of fibroids?
So if you've removed the uterus, then it shouldn't really come back, right? Because you've removed the uterus. Extremely rare circumstances where you might see a fibroid that embolizes and detaches from, the uterus itself and latches onto another part of the abdomen. It's called the metastasizing fibroid. Extremely rare, but can happen.
All right, thank you so much, Dr. Yemi. You spoke about the kind of fibroid when we talk about embolization. Can you refresh our mind on what kind of fibroids we have and which ones causes infertility?
Okay, so let me see if I can show you a picture of me see if I can show you a picture of a fibroid, the slide that has the fibroid. A second. Go back here. Okay, this. All right, I'm going to share my screen and show you this image. All right, let me make it a little bigger. Can you see this picture here?
Yes, we can see
Okay.
it.
So this sort of string hanging off is the fallopian tube. This is the meat of the muscle of the uterus itself, right? This is your cervix. This is the vaginal cavity. The fallopian tube, if you have a fibroid growing around here that gets really, really big, it can compress and cut off the fallopian tube. Normally, the egg is supposed to come out of the ovary, enter the tube, you get sperm come from it below, swims into the tube, and it fertilizes the egg inside the tube. The egg now fertilized is called the embryo and is gradually moved by the fallopian tube to the cavity. That movement takes about 5 days to get, roughly 5 days. So if you compress over here, you by necessity are going to interfere with the sperm and the egg meeting each other, right? And also, if you so distort the fibroid, the cavity, let's say you have a big, huge fibroid sticking in the cavity that's filling up the cavity, that can, in essence, prevent the embryo from lodging in. One of the things I always ask my patients, most people don't know, it's a little aside, is I know everybody's familiar with the camel caravans that travel across the Sahara Desert, right? So in the old days, that's what you used. And it was very efficacious if your camel did not get pregnant while they were going across the desert. So they would insert stones into the uterus. And those stones, in effect, act like an IUD and prevent implantation. So imagine if you now have the body's own stone sitting here, filling up this cavity, distorting the cavity, it makes it hard to get pregnant. Another thing too is the presence of a fibroid in the uterus can affect the inner layer of the uterus and make it hypercontractile, which is not conducive to implantation as well. Does that answer that question?
Yes, Doc. I have a hand raised. Madam Lara, you can unmute and ask your question, please.
All right. Actually, I'm a guest in Ms. Okunubi's house, so she wanted me to listen to this lecture. So I have a question about women in their mid-40s or late 40s having fibroids. So if a woman has never had any gynecological problems and at 47 develops fibroid, what is the doctor's advice in terms of operation? Or should the person wait till menopause kicks in and then everything goes back to normal in the sense of the heavy bleeding, the pain, and all this other stuff that comes along with it?
So, very good question. So the question I would usually ask the patient is this someone that's still trying to get pregnant? Because
No.
that changes. If they're not trying to get pregnant, the next question is, how big is the fibroid? Is it a small?
4.4 centimeters, she said.
Next question, where is it located? Is it in the cavity, outside the uterus, attached to the uterus, in the muscle of the uterus? The location is critical.
In what's that word? I think it starts with an H in terms of where it's sitting. So
Now,
it's not blocking the tube.
So the question is, what are the symptoms the patient is experiencing?
So she experiences heavy bleeding and clotting
Okay,
every month. But
So
what she does notice is that if she cuts down her sugar intake and her carb intake, the pain and the bleeding is not, the pain and the clotting is not as much.
Okay, so let me just share with you again my little picture, all right, to answer your question. So let's share. Okay, let me see which one is a better thing to show you. If she's bleeding heavily, 4 centimeters by itself is not necessarily a large fibroid. If she's experiencing heavy bleeding, the question is the cavity involved with the fibroid? That really matters with what you do. At age 47, a 4 centimeter fibroid, who's in someone who's not interested in getting pregnant, she can have uterine artery embolization done. But the question is, really honestly, how much of the cavity is involved? If it's only a little part of the cavity involved, that may be a good idea. If it's solely within the cavity and dangling off a thin thread within the cavity, and you embolize such a person, you could cause a spontaneous abortion of the fibroid. Believe me, there's something called an abortion of a fibroid. So she really needs to see her gynecologist to figure out where exactly is this fibroid and how much of the cavity is involved in order for the proper and most appropriate treatment be selected. A 4 centimeter fibroid is not necessarily big. If it's located within the muscle of the uterus or sort of close to the surface, what we call subserosa, those usually don't even cause any symptoms. So
but it's submucosal.
That's in the cavity.
Yes.
That's in the cavity. That's a problem. So, how much of the cavity is involved? And, you want to look at how much of the cavity is involved. Can it be embolized, or can you just simply do a hysteroscopic myomectomy? And I do that all the time, where you take a hysteroscopic blade and there's a musculator at the tip of it, and you just kind of do a roto-rooter and suck it out.
Okay.
That can be done. And before this evening is over, I will show you a slide of that one that I did.
All right, thank you. So you wouldn't necessarily advise anyone to continue to go through the motions till they hit menopause? Because like I was telling her, just because your siblings hit menopause at 50 does not necessarily mean that you hit menopause at 50. Maybe you won't get to menopause until 55. So would you be tolerating and dealing with such pain and such bleeding till that time?
Well, see, I think it's a tragedy for people to suffer that much. You need to talk to your gynecologist because you may bleed a lot that causes severe anemia.
Yeah.
And blood loss. And we know that by itself is not healthy. So yeah, I think she needs to see her gynecologist. You need to have it evaluated, what's involved, how much of the cavity is involved, and for that matter, what's her blood count as we speak. I think I've seen people hemorrhage to such a point where it becomes life-threatening. I mean, people can die from this thing. So you just don't ignore it. For a 4 centimeter fibroid that can be easily treated any which way, I do not advise ignoring it.
Okay, I'll tell her. Thank you.
Thank you so much, Madam Lara and Dr. Yemi, for your answers. You are encouraged to keep your questions coming in. It will help someone know more about this particular topic we are trading, which is very important. There is a question from Hannah and Ephraim AJ. Say, can one have a successful pregnancy with fibroid?
She's muted.
Hello, Dr. Yemi, you're muted.
I'm sorry about that. So absolutely, people get pregnant with fibroids all the time and have a successful pregnancy all the time. It depends how big is the fibroid, where is it located, and what are the symptoms the patient's experiencing. Sometimes if a fibroid grows rapidly in pregnancy, if it's a large fibroid, it can outgrow its blood supply and necrose, and that causes pain. So you have to manage it throughout pregnancy. But people get pregnant and do fine all the time. So the biggest recommendation is please, please, please talk to your doctor, have them evaluate you, and see, you know, I think fibroids are one of the few places in medicine where the treatment is individualized.
Mm.
They need to look at you, evaluate your uterus, and come up with a treatment plan that's specific for you. Because, you know, just as their fibroids come in numerous shapes and forms. Some people have one big old fibroid and that's it. And you take it out, it never comes back. Some people have multiple fibroids. It's like every single cell within the muscle of the uterus is trying to form its own independent fibroid. So it really must be individualized. I can't overemphasize that.
Let me just do a follow-up on that, your last statement, that fibroids could come back after treatment. What are the chances?
Most of the fibroids that tend to come back are fibroids that are multi-located, more than one, tend to come back. If you have one single fibroid, the recurrence risk is not as high. If you have multiple fibroids, the recurrence risk is high. And they can also come back after uterine artery embolization, by the way. So they can recur.
Thank you so much. I have a question from the Abija family. It says, what are some common signs to detect fibroids in addition to bleeding? They're not sure if painful experience during sexual intercourse can be one of them. And is that the underlying cause of infertility?
So fibroid symptoms can be ubiquitous. If the fibroid is located in a very abnormal location, it may cause pain during intercourse. That's one of the symptoms that you see. Sometimes people have pressure. They feel full. They go into the bathroom a lot. They're going, they have pressure when they're trying to have a bowel movement, or they have a lower abdominal pressure as if they're pregnant, but it's vague, or they notice that their waistline is increasing and they think, oh yeah, I'm just eating too much. Maybe you're not eating too much. I've had numerous women who, since the fibroid can grow up, can grow out, if it grows up into the cavity, those ones usually get very big before you detect it, because your abdominal cavity is a potential space. It will make room for itself. It will shove everything out of the way. Sometimes it causes bladder problems because they grow out and they compress your ureters, and they can compress the bladder. So anything in the pelvic abdominal area that can be compressed upon can be compressed by fibroids.
You're listening to Medical Mondays with Dr. O, and we are discussing fibroids and fertility with Dr. Oluyemisi Famuyiwa, a fellow of the American Congress of Obstetricians and Gynecologists. Keep your questions coming in, and remember to hit the like button if you watching on YouTube. Also subscribe to the Medical Monday channel on YouTube and hit the notification bell on the page. You will be notified for future shows and can join us with one click of a button. Questions keep coming in, and let me pick the next one. It says, can you throw more light on the vitamin D deficiency? Back in Africa, we have a super abundance of sunlight to supplement. Yes. What recommendation of food sources helps?
Okay, so I'm going to flash back to my slide a little bit to answer that question. The thing with vitamin D those are observational studies that suggest that deficiency of vitamin D could contribute to fibroids. And, of course, everybody's going to say, well, we have tons of vitamin D in Africa. I don't think it's one thing that's causing fibroids. So I can't say that it's vitamin D deficiency will definitely result in fibroids. I think having low vitamin D can make things worse. As far as the foods that you can eat, let's go over this again. Let me see if I can share this again because I did show it. Let's go back to my slide. And here we are. Refined carbohydrates. You know, in general, these are the things that give you poor health anyway, right? Those are the things that makes diabetes worse. They make your high blood pressure worse. Now, if you read Dr. Sanjay Gupta's book, can also contribute to dementia. So for that alone, I'd be scared off them. So you want to eat food that has a low inflammatory potential. And then, let me see, we talked about highly processed meats, especially if you're eating, you know, cattle that's been raised on a farm that they feed this cattle steroids and hormones. Well, guess what? You're going to partake in that steroids and hormones. Avoiding salt, too much salt. You know, it doesn't have to be overly salty. What can you eat? The same things that we advise to have a healthy fertility potential: fruits, vegetables, apples, broccoli, cabbage, whole grain, nuts. Those things will help you live longer in general and may also help you avoid fibroids. If you have high blood pressure, control it. Talk to your doctor, get it treated. If you're stressed out, do some distressing exercises. Take a couple of deep breaths in the middle of the day, you know, let it out, you know, roll your shoulders back and forth, take out the stress. You know, if you find yourself dwelling on negative thoughts, tell yourself a mental stop. You know, those are wholesome habits anyway that will help you live longer. So if they also help you decrease the chance of fibroids, wonderful, so be it.
Good diet helps a lot. I have a question from Tawa. It says, is it true that you can carry your embryo in the peritoneal cavity if your uterus was surgically removed?
Absolutely not. You'll have what is called an abdominal pregnancy, and you would need a new uterus. Now, there have been cases where you have uterine transplantation. That's been done successfully. It's not everywhere yet. It's not, you know, ready for prime time. But to sustain a pregnancy within the uterus itself, that's called an abdominal ectopic pregnancy. That's life-threatening. You will hemorrhage, especially if it attaches to bowel. It could attach to anything. So no, that's not the way it's done.
Thank you so much. Thank you for the insightful knowledge being shared here on Medical Mondays with Dr. O. We appreciate you, Dr. Yemi. Another one from Dr. Caprice says that, is this a comment? Great information, Doctor. You can also ask your question. You can drop it in the chat box, or you can raise your hand and then we will call you to ask your question and you can interact with our guest, Dr. Yemi Famuyiwa. You are on the Medical Mondays with Dr. O, and we're talking tonight fibroid and fertility. Lara Famuyiwa says, can you get fibroids in menopause?
Extremely rare for it to pop up in menopause. You know, anything that's rapidly growing or grows after menopause is not hormonal dependent, which a fibroid is. So if you get a rapid growth in menopause, the first thing I would think about is rule out cancer, right? Rule out a leiomyosarcoma, which is a cancer of the muscle of the uterus. So yeah, if you get it growing in menopause, you need to get checked out immediately to rule out cancer.
Okay, and the next question, are fibroids preventable?
In as much as we don't really understand why fibroids pop up, the preventive measures that I just went over in terms of trying to live a wholesome, healthy life in terms of what you feed into your body. And as much as, that can help you live a longer life, I guess you could pursue that. I don't think we fully 100% know that factor X is why people get fibroids. We don't yet know that.
Keep your questions coming in. One from Dr. Caprice. How does a woman know she is in menopause?
Well, one of the easiest way is if you have hot flashes and you stop your menstrual cycle, right? But if you've had a hysterectomy, you're not going to know, are you? Right? Because, you don't know because your uterus, which is one of the things that tells you whether or not you're bleeding, is gone. So you can have hormonal studies done that can confirm whether or not you're in menopause as well.
Thank you so much, Dr. Caprice, for that question. We appreciate those kind of questions. Don't be shy to ask questions. Any questions that you ask, we will learn from it. So keep them coming. Keep the chat box flooded with your questions. You can also raise your hand and then we will call you. What factor does raise, is there a factor? Is there a factor in fibroids? Why?
Fibroids, yes, that's a very good question. Fibroids are found in all human races, right? There's a slight increased incidence in African Americans, though. It's slightly more common, but it can affect everybody. But yes, in African Americans, slightly increased in incidence.
Well, so not just fibroid, but other cases like diabetes and seem to be prevalent with the African American community. And a special reason why?
Well, I can't really say too much about other health factors. I think if you've been participating with Dr. O's forum, where she tries to encourage us to live the best and most healthy life we possibly can. Diabetes, if it's type 2 diabetes, adult onset, those are things that we can try to avoid by the lifestyle we choose, right? And if you happen to have it, you can moderate it and keep it controlled, again, by the lifestyle you choose. Don't be sedentary, move around, exercise. Now, I'm not asking you to try and compete for the Olympic, but move your body around, move your legs up and down, go for a walk. If the weather is good, people who walk 30 minutes a day tend to live longer anyway. And if you're like me, where you have a very narrow temperature range, I don't like it when it's too hot, and I certainly don't like it when it's too cold. Floor exercises. I don't like high impact exercise either. But you might be surprised. Floor exercises, mini yoga stretches, all those things help. And if you make it part of your life, when you wake up out of bed, stretch, do a couple of floor exercises, spend 5-10 minutes. On the day that you have time, make it 30 minutes. If you don't, at least 10 minutes. It's a very good way to start your body. And everybody should inculcate it. Why do some people, remember, I see a lot of people on this forum are from Africa. I don't know if you grew up with grandmothers. I know my grandmother lived into, I think they forgot her age after a while. She was over 105. And that woman was like a little Energizer bunny. She never stopped. But they lived on the farm. They went to the stream. They planted. They were active. They cleaned. They did a lot of things. So move around. It's a good thing. And, on the farm, they ate fresh food. They ate what came off the farm. They, talk about your, truly organic lifestyle living. So those things, let's remember a little bit of that. Let's go back to a little bit of that.
Exercise is key. That little half-hour walk or 15 minutes walk during your lunch breaks adds up. So good diet, exercise, it all helps to keep you healthy. A question from Edna Ogona: is it necessary to surgically remove fibroid after menopause?
Again, it depends on how big is the fibroid. Is it compromising something? If you have a fibroid that is cutting off the drainage of your kidneys, and you don't address that fibroid, you could compromise your renal function. So first you start out with one problem, and then you end up with another one. So you've got to evaluate what are the symptoms, what is being compromised, what is being compressed, how big is the fibroid, where is it located? Again, that goes into that, what I told you, that fibroid treatment is an individualized endeavor. You have to call your gynecologist, work with them, ask questions. If you're not getting answers, ask for a second opinion. There's nothing wrong with that, but talk to a gynecologist, right? That would be the first person I would talk to.
From Hannah and from AJ, thanks so much for the deep knowledge you are sharing with us. Why are fibroids sometimes so scary in some cultures? And also, which type of fibroid is the most dangerous?
I think, I don't know if you've been listening all along, I'll go over. We do have a prevalence a higher prevalence in African Americans. There may be some genetic causes because it tends to run in families. You'll hear people say, well, my aunt had it, my mother had it, my sister had it, my grandmother had it. So there's an inherited component. There are people that study certain genes that are turned on with fibroids that may end up being inherited. As far as the other question was, what was the other part of the question?
Which type is the most dangerous?
I don't know that you can decide one is more dangerous than the other. Again, how big is it? Where is it located? That will determine the danger of it.
So it depends on the location.
Location, and size.
All right. I have one from Daisy. Says, are you able to describe what a hot flash feels like? Does it vary with individuals?
I think it varies. That's a very good question. I think there was a show that Oprah gave at one time where she said she was having symptoms, and because she was Oprah, she went to the emergency room. They were working her up for a heart attack, a stroke, and whatever. And she was just simply going through menopause. So I think the symptoms vary. Some people all of a sudden get really hot, or they wake up sweating. But symptoms may vary from individual to individual.
Thank you so much, Dr. Yemi, for that insightful and that educative talk on fibroid and fertility. You are on the Medical Mondays with Dr. O. And a few more questions coming up. Let me quickly get to them. Says, what danger does the gestational diabetes present? Well,
okay, so again, good question. I don't know that it's necessarily related to fibroids. Mm-hmm. That's a pregnancy issue. So that has to be managed by your obstetrician and maybe a high-risk pregnancy doctor. But I don't know that the two are necessarily related to fibroids.
From the Abijah family, says, not trying to be funny, but I am glad you touched on the hereditary topic, which may pass something down the line. If your mother or sister had fibroids, should one be concerned, even when in good health, to get in screening to get screening for it or ignore it altogether?
Well, a good question. I don't think we should ignore our health. I think if you just follow what we normally advise, where you go see your gynecologist, you get a pap smear, you get a pelvic examination. I think those are general things that we advise women to do anyway. So in those endeavors is when you may sometimes pick up things that are not the way they should be. You go do a pelvic exam and they notice your uterus is yay big instead of the size of your fist. That could be a problem. So I think just doing what we normally do to stay healthy would be sufficient.
There's a hand up I would like to go to Maureen. Maureen Booker for your question.
Yes, I just wanted Dr. Yemi to tell us if you could be confused with adenomyosis for fibroids on vaginal exams.
Thank you. And that, by the way, is Dr. Maureen Booker. She's a wonderful friend of mine. She did a sneak peek into it. So yes, Dr. Booker, adenomyosis is when I always explain it to my patient. That is endometriosis that's located in the muscle of the uterus. What is endometriosis? You see that stuff that's supposed to shed when you have a menstrual cycle? Imagine instead of shedding and coming out, it sheds and go into the muscle. It's not supposed to be there. Sometimes it can shed, it can infiltrate the muscle and becomes extensive, or sometimes it becomes localized and it's in a small spot, so that on ultrasound, it may resemble a fibroid. And then they go in to remove it and go, oh my goodness, this is not a fibroid, this is adenomyosis. The difference is adenomyosis infiltrates the muscle, hardens the muscle, makes it non-pliable, tends to be infiltrated. Fibroid tends to spread by compression and forms a pseudocapsule. If I were to go remove a fibroid, you could really just shell it out of its capsule, almost like a big zit coming out. Adenomyosis doesn't separate from the rest of the muscle because it's infiltrated. If it's focal, which we call focal, there have been individuals that will go in and try to cut out that area and have achieved success with that. I think they do that more commonly in Japan. But in general, it tends to be infiltrated. So when you try to cut it out, if you're not careful, you'll end up cutting out the entire uterus. You can't detect the difference if there are some characteristic finding with fibroids and adenomyosis. When you do an ultrasound, you have to be familiar with it to look for it. There's a certain shadowing pattern, but you might see subendometrial cysts in an ultrasound. That's very common with adenomyosis. You see cysts within the muscle of the uterus itself. They're like lakes. That's very common. They're like chocolate-filled lakes within the myometrium. And even down, if you do an MRI with and without, MRI can delineate the difference of the two.
All right, follow up on the screening. Is too much screening a concern?
Well, that's a good question. I don't know what you define as too much screening. I think you should just do your annual exam. See your gynecologist when you need to get your pap smear done. See your internist when you need to have your cholesterol checked. I don't think anyone is advocating that you get screened every 6 to 8 months or something like that, but most people would at least see their doctor once, or maybe once a year, once every 2 years or something, to make sure everything is working. I mean, you take your car for a tune-up, don't you? So take yourself to get a tune-up, see what's going on.
All right. Why is there a high mortality rate when it comes to fibroid removal in some parts of the world?
That's a loaded question. I'm not so sure. It depends on when you say some parts of the world. Maybe you could elaborate. What do you mean by that? It depends on what you're getting done. What kind of surgery, how big, location, and so on and so forth.
Say Africa.
Well, I don't necessarily know that Africa per se is bad. I mean, there's some cases where, doctors are very good and do a good job. So you have a good chance of having a good outcome.
Thank you so much, Dr. Yemi, for that wonderful presentation and answering all the questions. We are grateful to have you here, and we have learned a lot from the ongoing discussion. I have dropped a contact in the chat box, so if you have any questions, addressed to her outside of this topic, or if you have a follow-up on some of the things that she's spoken about, you can contact her. I have already shared her contacts in the chat box. And also, you can also send your questions if you need information to Medical Mondays, Dr. O at gmail.com. The Dr. O is DRO, Medical Mondays, Dr. O at gmail.com. Please share the Medical Mondays link and invite your friend or family. On YouTube, it is Medical Mondays with Dr. O. We are also on Facebook, the Medical Mondays with Dr. O. Please subscribe to the channel and be sure to hit the notification page. Before we leave, your final thoughts.
I thank you so much for taking the time to hear me out. Thank you for joining this forum. It's really wonderful. I'm grateful for you to invite me. Final thoughts. I think fibroids are just extensive. Fibroids affect a lot of people and affect your health. So it's good to get the conversation going and let people be aware of this, and also to make sure that we're choosing the appropriate treatment. I can't emphasize that enough, because if the wrong treatment is given, it can affect patient's outcome.
Thank you once again. And we have an award to be announced, winner for bringing between 10 and 20 people to Medical Mondays. Remember that over 20 people, if you're able to bring over 20 people to the channel, you get a Champions Award. And so far, there is only one champion, and the person of Dr. Ajagbe is the undisputed. So I think it needs a contender for that title. So challenge Dr. Ajagbe by bringing more or over 20 people to the channel. It's time to announce our winner for the day, and Dr. Caprice will announce the winner and the gift.
Hello, everyone. It's actually Ephraim and Hannah again. Congratulations. Again, you get an Amazon gift card. We definitely want some competition with them because they've been winning a lot, but we really, really appreciate it for all the work they're doing and the people that they're bringing. Thank you so much, and congratulations again, you guys.
Thank you.
Thank you. Thank you. Dr. Yemi, if you don't mind, there's a question I would like to ask from Lara. Says, do you recommend hormonal replacement after hysterectomy, and for how long?
Depends on when the hysterectomy was done. Was it done at a very early age? Was it done, in a menopausal state? So it depends on when that was done. Again, I think it goes into what I mentioned about individualizing therapy.
Thank you so much. Great job, Dr. Famuyiwa. And another person, that's Marsha Edwards, says, thank you so much for this. My first visit, but I intend to return. Kudos to Dr. O in absentia for inviting, and Dr. Famuyiwa for a very informative session. Thank you so much.
Thank you
for coming, and thank you so much, Marsha. We love you. You've been listening to Dr. Oluyemisi Famuyiwa, a fellow of the American Congress of Obstetricians and Gynecologists, and the founder of Montgomery Fertility Center in Rockville, Maryland, speak about fibroid and fertility. Thank you, Dr. Yemi, and each of you for coming. We continue our mission to inform, educate, inspire, and empower you with medical information and more. This includes fitness, nutrition, health and wellness, lifestyle boost, and joy and peace for the soul. Remember to please share the Medical Mondays link and invite friends to the program. It's been a pleasure coming your way, and we appreciate you joining us. Thank you so much. And this concludes another exciting conversation about your health, and looking forward to next Monday. Thank you so much. Good night, and God bless you.
Thank you. Good night.
Thank
God
you
bless.
very much. Thank you for having us.
Thank you. God
Bye.
bless you.
Thank
Thank you.
God bless you. Bye-bye.
Bye.
Bye.
Yeah.
Thank you. Good night. Okay.
Good night.
Dr. Ajay, I have a question as we leave. Dr. Yemi.
Yes.
Dr. Yemi, a quick
Yes.
question. Does the attendance support a grant, or what is it that of course, the most important is it's information and dispersing. But
Yes.
it's helpful for us to know if that supports and makes for the grants continuity, so that people actually are putting effort and making sure we don't lose that funding. Does it support?
When you say a grant from who?
Right. Again, it's really my question. Is there a funding for this project that attendance supports? Meaning, is this project that you're doing, which is the information, which is of course the most important that we're gathering, but I'm just wondering if the incentive for attendance is also to make sure that whoever's funding this project is able to continue it, or is it the purpose is of offering incentive? Is that just so we make sure we're dispersing information, or is it because it supports you being funded to do this? I'm curious because I might help people to know.
Yeah, I mean, I think anytime you can get a grant in doing something that is wonderful like this is wonderful. I think you need to kind of address that question to Dr. O herself.
Okay. All right.
I think it's a worthy cause. I mean,
Got it.
I think that we all that are, volunteering to do this, it's not like I'm being paid. It's because I like what I do. I like talking to people. If you let me, I'll talk all night long. but
Right.
I think most of the physicians who've come to this forum have been of that same ilk, where we come together, we share information. And another thing I'm noticing is a lot of doctors themselves also come in here, and I welcome that. That's wonderful. So I wonder if we could spill over and have one for the general public and maybe one for doctors too, almost like a CME thing, where
Right.
we can share knowledge. I'd like to have this grow into like a clubhouse event where we bring different doctors together, doctors from our own background.
Right.
We don't have to attend all these big international expensive meetings before
Right.
we can share. I can call you and say, hey, Dr. J, what have you heard, being done over in New York or here, or what is being done in Cyprus, or what is the take in Ghana, for instance.
Right.
So I think anytime you can bring a healthy forum, more power for it. I think I salute Dr. O for it. Again, when she comes back, you can pose the question to her. But I totally agree. And first off, let me say, I just admire her. Do you know how much effort it takes to do this? And for her to do it week after week, yes, she deserves a grant. It takes
Absolutely.
a lot,
Absolutely.
and I mean, I could be preparing or, reviewing charts or, in the preparation time, seeing patients or spending time with my family. She does it every week.
Yeah.
Kudos to her,
Absolutely, Dr. Famuyiwa, I agree. Thank you. And I think my purpose was we have the same projects for funding from a source to give legal information to the public. And we were as well encouraging attendance. And that helps to go back to the funders to say, this is working, give us more funds. I just wanted to make sure that if it's the purpose that we let, we kind of let the critical people know so we can, because the whole purpose is what you said, is community and educating our community for the global good, which is fantastic, which is why everybody will show up. But I also was curious if that it supports the funding, but I can ask Dr. O, because I thought that you were all doing it together, but I can ask Dr.
Also, thank you, Dr. O, for that. And Dr. Femi, you said it so right. And I know you are doing like a pro bono, meaning that your heart is just out for the people, for your people, to make sure that the knowledge and information that we don't have, that's why Dr. Kapis will tell you strong future. We want to get the knowledge that we can equip ourselves to make sure we're living well.
Yes.
And we are taking care of that disparity as well. So whatever will make it say better, share with Dr. O as well. And I believe she welcomed that.
Yes.
Thank you very much. All right, great. I think my questions were answered. I look forward to next Monday. Thank you so much.
Yes. Yes.
Thank you for all your work today. Very informative.
Thank you, everybody. Thank you so much.
I appreciate it.
Thank you. Thank you, Dr. Yemi. We appreciate you.
Thank you, Dr. J. You are wonderful. I must say it really helps when you have someone you can bounce off to. I think it makes the forum more energetic. So I love this forum. And I learned a lot from Dr. O herself, because she always told, because I came up in where I give academic lectures all the time. And I give 30 or 40 slides, enough to feel like an hour and a half. And she was like, no. We want a few slides, a few information, but we want to engage. So I like that.
Yeah, it was so interactive and great.
Yeah.
We appreciate you.
Thank you. Thank you.
Thank you. Good night.
Good night.
All right. Good night. Good night, Dr. Ajay. I'm going to call off. Thank you so much. It's been wonderful. Thank you.
Good night. Thank you.
All right.
Good night.
Good night.